Hi everybody, my name is Emily. I'm a nurse here on Fibronellis at Christus Trinity Mother Frances Hospital, Tyler. And today we're performing a demonstration on proper technique, usage, and preparation for continuous bladder irrigation, commonly referred to as CBI. First, we want to go over what we need to prepare for. When I know that I'm going to receive a patient that's receiving continuous bladder irrigation, there's a few things that I want to go ahead and have ready. One, you want to consider that this bag of NS, it's a 3 liter bag of sodium chloride. This is considered a medication, so you don't want to have this in the room before your patient gets there. You will need a few of these on store, so make sure that your unit is stocked with these because you don't ever want your bags to run dry. You can go ahead and prepare your rooms by grabbing a container of sterile water. For this demonstration, we're just using a canister labeled as sterile water. It's good to have a few of these canisters, and oftentimes you can grab a basin just to collect all of these canisters and hold them in because you'll oftentimes be emptying them out very frequently. You'll want to have an irrigation tray. This contains a piston syringe. Typically it's a 60 cc piston syringe that you'll use to manually irrigate whenever you run into any clot formation or reduced urine output that requires some intervention at the bedside from the nursing staff. It's often good to go ahead and grab a few chuck pads as well. It can be messy. The patient will be coming with a 3-way Foley catheter inside you. So as you can see here, it has 3 ports or 3 lumens. You'll notice that this is typically a larger diameter catheter. 24 French, 22 French is very common or more because you want that open patency if in the event that you run into any excess debris or clot formation. You'll have this sterile port to a 4-liter catheter bag. This last port here is connected to your irrigation solution. You always want to initially assess your tubing from the irrigation solution. This is a priority. Oftentimes this solution is running at a high rate initially. You'll have 2 bags hanging at all times. What you need to pay close attention to is that one bag is always clamped right here to the tightest position because only one bag should be running at a time. When we have it running at a high rate, this is going to empty out pretty quickly. So we have the backup bag prepared so that when this is running empty, you can open this bag, open this clamp, and allow this bag to flow through there. Here we have a roller clamp, and this is where you are responsible for titrating the speed of the rate. It is your responsibility to ensure that the bags don't run dry and that the urine is as clear as possible. You'll see right after surgery that there's a lot of debris or clot formation initially, so it's not uncommon to see very dark red blood here in the catheter tubing. There's 5 different grades of blood color that we're monitoring. The darker and the more debris that is in the urine, the faster the rate that you will want it to run. You'll have standing orders to follow, of course. Typically, you'll see that you want to start weaning the CBI down. Once the urine is starting to become more clear, it's irrigating the bladder to allow free urine flow throughout the bladder to help clean it out. You just roll it down, tighten it up a bit, and you can monitor the speed of the flow rate right through this little chamber here. You'll notice whenever it's on full flow, it's running very, very quickly. The bags are going to bleed dry very quick. And then as the urine is starting to clear up and we're not having as much blood clots, you can slowly reduce that rate. Another aspect that we need to be closely monitoring is the color here in the tubing versus the drainage bag. The color of the urine output in the drainage bag is very deceiving. What you need to pay closer attention to is what is the color of the urine here in the tubing itself. Pay more close attention to this versus what is here in the bag. Another important aspect is keeping your bag empty. These fill up very, very quick initially after your surgery. So have your canisters ready, closely document and monitor your outputs, and we'll discuss how to document this properly here in a bit at the end of the video. Good rule of thumb is once you're noticing the bag getting about halfway full or so, go ahead and empty your bag because at that point you don't want to get behind and then it start filling up and then we have some refractory backing up of the urine into the bladder. Let's talk color here. When we're seeing a very dark urine color, such as like a grape color or a very deep red cranberry color, that's a good indication that we need to speed up the rate of the irrigant solution. When we start to lighten up in color and it starts to turn a little more cherry pink or pinker in color, that's when you know you can start to manually slow down that irrigant just a bit. If at any point you slow down that irrigation and it's turning pink and then we revert back to a deeper red color, speed that irrigation back up. Oftentimes, you'll have to have some changes in your consistency with the rate just until we find that happy medium. You can keep a slower rate as long as the urine flow is still clear. Typically, by early the next morning, your urologist is going to come by at bedside and evaluate the patient. You would wait until they put in a specific order set to stop the CBI. However, if the order remains in place for the continuous bladder irrigation, keep performing the continuous bladder irrigation, even if the rate is very, very slow. Let's demonstrate how to change the irrigant solution bag. So what we'll do is clamp this side and open up your new bag. You've got your brand new bag here. You just tear the plastic off. We'll utilize the white port. This is a sterile port, so just be cautious. There's a little gold film that'll come off. Remove this spike and re-spike your brand new bag. You'll fully spike that bag, ensure that it is clamped, it's your backup. A good tip is, depending on which number bag it is, let's pretend like this is bag number 3. You can take a Sharpie and write bag number 3. That way it allows you to help keep up with your intake, what is going into the bladder versus the output, which is going to be very prudent, precise documentation. Our new bag is free flowing. We'll monitor it for it to get close to empty. And then when this one is empty, we can go ahead and clamp this off and open up your brand new bag. Let's discuss any interruption in the urine flow from the catheter tubing in the bag. This procedure relatively should be pretty painless. It might be a little uncomfortable for some patient, but there shouldn't be any extreme pain. Now, if your patient calls you and says that their bladder is hurting or their abdomen's hurting really badly, you want to go run in there and take a look at the flow. If you're not seeing any urine flow at all, it could indicate that we have some sort of clot formation or it's stopped up. Or if you're seeing a reduced urine flow and you've got a high rate of speed flowing here, think of your Cotty bundles. We want to monitor for any kinking in the tubing. We want to make sure that there's no dependent loop. The bag's not too full. If you've just noticed, okay, we don't have any urine output at all, but I do see that the bladder should be filling up with the irrigant. It's a good idea to go ahead and do an irrigation. Now that is as long as you have an order for manual irrigation or hand irrigation. Notify the patient. We're going to disconnect you for just a second and work a bit with your catheter just to make sure that we don't have any clot there. This right here has your 60 cc piston syringe. All that you will need is your sterile water. You'll take your piston syringe and we'll fill it up twice. There's 60 cc's right here that we should be filling up with. You'll disconnect this middle port from the catheter tubing itself. And I've already withdrawn 60 cc's of sterile water. I'll connect that to this middle lumen there, and I'll slowly instill that sterile water. Now, something to be mindful of is if you have a lot of resistance, you might just pull back a little bit. That's giving that pressure to help break up whatever might be there. However, if you have complete resistance, just stop. If it's inflicting a lot of pain for the patient, you want to be mindful of that. For both men and women, it can cause what's called bladder spasming, which causes some discomfort. Here's our second syringe, and then we will pull back 2 syringes worth and discard that as well. And as you can see there, we'll pretend like there was a blood clot that was causing an interruption in the urine flow. So we'll go ahead and remove about 60 cc's there. And depending on the patient condition, you might have to do this more frequently. Sometimes you might not have to do it at all. We'll connect this back to the catheter tubing and just assess the urine flow. Now, while this isn't in a human bladder, Mr. Foley is plastic here, of course. We'll just pretend that urine is flowing now so that we know that that was a successful hand irrigation of the bladder. We're going to go ahead and take a look here at how we would document a CBI in Epic. Of course, we're going to start by going into your flow sheets, followed by tracking over to your intake and your output. There will be a specific CBI portion here that you should be documenting very accurately on. The columns here we have is the rate, irrigant, CBI irrigation intake, urine clarity, urine color, the Foley output, and the net output. Looking at the rate, we've got slow, moderate, fast, and manual. Document each time that you adjust that flow rate, whether you're speeding it up or slowing it down. The irrigant, not oftentimes do we see 1.5% glycine. Normally it's just normal saline, but be very specific if you do have a swap up in orders. You should be documenting the intake, which is the irrigation solution, very accurately. There is 3 liters or 3,000 cc's of that normal saline in each bag, so if you run through a whole bag, you need to document 3,000 cc's versus the output, the CBI Foley output. That needs to be very accurate as well. The CBI net output should never be less than the intake. It should never be negative. If you have a negative output, then we're wondering, where is that irrigant solution going to? Why is it not emptying? Thank you guys for watching. This concludes our demonstration for how to perform a continuous bladder irrigation. If you have any further questions, feel free to reach out to your designated unit educator.